Welcome to another episode of Black Scholars Speak as we laugh, inspire, uplift, and challenge the status quo. This is Black Scholars Speak. Alrighty, everybody, welcome back to another episode of Black Scholars Speak. I am your host, Janelle Gore, and today I'm so happy to have with us Dr. Feylyn Lewis. And so we're just, yes. Welcome. Thank you so much for being here today.
Thank you so much for having me, Janelle. It's a real honor.
It is. And y'all will hear, I have known Dr. Feylyn Lewis now for what, I guess like 2 or 3 years?
Yeah. Some time.
It has. But it's so crazy because I kind of feel like it was yesterday whenever I reached out. So that's kind of wild, actually. And so I'm really happy to have her because some of what you all know, some of my research interest is working with youth caregivers. And so a part of me, when I first reached out back to Dr. Lewis back few years ago, it was so that I could learn more about youth caregiving. And I was speaking to another colleague, Aisha, and she was like, oh, well, I know the perfect person. And she's like the leading youth caregiving person in the US. She studied in the UK. And she's one of the only folks with her dissertation who's kind of compared youth across from the UK to here in the US. And so I was like, what? I have to meet her. And so that's kind of where our relationship has started. So I'm really happy and excited for us to have this conversation today about her journey, as well as about youth caregiving too as well. So hopefully this episode is of interest to you if this is something that, y'all are interested in. But before we get too far deep, I want to make sure I do a proper introduction of Dr. Lewis. And so I'm going to let you know a little bit about her. She is a native Nashville, Tennessee, Vanderbilt University alumni. She grew up as a younger caregiver for her disabled mother. Her experience with youth caregiving, disability, and living life on the margins led her on a path of global research and advocacy. She has a master's degree in clinical mental health counseling and a PhD in social work. Her research focuses on mental health and resiliency in youth and young adult caregivers, and she conducts research in the US, Europe, UK, and Australia. Global. Dr. Lewis currently works as the Assistant Dean of Student Affairs at Vanderbilt University School of Nursing, where she is responsible for providing vision, leadership, and strategic planning for student affairs programming that delivers holistic wellness, formal support services, student life, and community engagement. Outside of work, she serves as the Vice President of Diversity, Equity, and Inclusion and Belonging in the Junior League of Nashville, a board member of the Tennessee Caregiver Coalition, and the Brighton and Hove? Am I saying that right, Dr. Hove?
Yeah.
Career Center in the United Kingdom, and the co-chairs of the congressionally appointed PCORI Healthcare Delivery and Disparities Research Advisory Panel. She sits on numerous other international advisory boards. She currently resides in Nashville, where she continues to provide care for her mother. Wow, I actually learned something new, a lot of stuff new from your bio.
Oh,
so I didn't know that you were social work, that you got your PhD in social work. I didn't know that. And I didn't know the mental health counseling piece either. I only knew you as nursing.
Oh, okay.
So,
yeah, it's a little confession, but I have to explain though, Janelle. So it's because I did my PhD in England. So I'm not a social worker. So all props and all credit to social workers, but I'm not one. I can't claim it. It's just because the British system, if you're supervisor social worker, that is what your PhD will be in. So because he was a social worker, my PhD is in social work. So it's just the funny UK-US difference there. So no.
I see. I guess it's kind of similar though, right? Because like if you find a mentor, you usually find them within the program that you're gonna be in.
Yeah. Very true, very, very
Um,
true. But yeah, I identify more as like I was trained as a therapist, and so yeah, but mental health's my jam.
Awesome, awesome. Well, then, you know what, Dr. Lewis, tell us a little bit more just about like your journey and how you got into, yeah, like, but if you could start more at the beginning and more of how your experiences as a youth caregiver, because you said that you grew up caring for your mom, how that influenced kind of like your trajectory and where you are now.
Yeah, absolutely, Janelle. So you're right. My story really began when I was a child. When I was 11 years old, my mother was diagnosed with degenerative disc disease, and she had what was considered to be a routine surgery for that condition. But unfortunately, the surgeon took out bones from her spine that he shouldn't have, and she woke up unable to walk. And our lives just changed in an instant. And before she was working as a registered nurse, like she was running marathons in Alaska, like really healthy, able bodied woman. And because she had a botched surgery, I was thrust into youth caregiving. I always have to give
Mhm.
credit to my older brother, Farrell. He's 7 years older than me. He was going into his sophomore year in college, studying electrical engineering, having the time of his life, going rock climbing out of state, not telling my mom. Like he was just enjoying being a college student, right? And he came home that weekend of her surgery just thinking that he'd be home for that weekend. But because her surgery was botched, he ended up staying home indefinitely and he dropped out of college. He got a job at FedEx lifting boxes to pay for our mortgage, our household bills. And that is for him his young adult caregiving story. That's when that started. And then for me, I also started caregiving for our mom at age 11. And I was doing intimate care, so like washing, helping her get dressed, administering her medicines, helping her with relearning walking.
Mm.
And she had a number of attempted corrective surgeries over the years to no avail. But that meant helping her wound care and things like that. Um, I did not know anyone else who had a story like me and my brother. And in fact, it wasn't until I was in college and I asked my therapist at the time. So shout out to therapists, they're great. And I asked him, I said, do you know anybody else who's like me and my brother where they're taking care of a parent? And he looked me in the eye and he's like, no, I don't. And Janelle, I just felt so alone, like I just felt like, okay, this person is like a therapist, he's gone to school, he's got his PhD, and he can't say in literature that there's anybody like me and my brother. Like, oh my goodness. So that always stayed with me. And I went on to do a master's in counseling. And when I was in my last year, you had to do kind of like a mini dissertation. And I decided I wanted to see what was out there about younger age caregivers. And I discovered that there was a whole like breadth of research, but it just wasn't happening in the US. Like it was happening
Yeah.
in Europe and more specifically in the United Kingdom and more specifically in England. So I knew right then, like that was my hook. It was like my world was open. And I'm like, okay, like I saw myself, I saw my family reflected in the research. And I just knew right then and there, I'm like, okay, I have to do something about it. I've got to bring that back here. So that's where it started for me.
That is awesome. And so, well, let me say not awesome. That is a really, um, I'll say it's awesome in the way that you and your brother were able to say, like, hey, our mom needs us and we have to do our part. But I also know that, like, being a child at that point and taking on that,
Mhm.
I can't imagine you felt like, oh, this is something I really want to do. Like, this is it.
Yeah.
Um, how did you even like learn how to do like the wound care aspect of things too?
Oh, that's such a great question. I think for so many kids like myself, I think you just do it, right? Like, thankfully, my mom was a nurse, so she knew to like tell, she could instruct me.
Mm.
But I also recognize that that was a privilege, right? That like my mom could still verbally walk me through what to do. But that's not true for any other, that may not be true for other children and adolescents in that position. But yeah, it
Right.
was absolutely just a time of isolation and fear too. Janelle, I was so scared because I didn't, nobody explained what happened with my mom. All I
Mm.
knew is she went in healthy and went into that surgery able bodied and then came out like unable to walk. So nobody, there weren't any doctors or nurses or social workers or home health aides who could explain to me as a child what happened to my mom. So I had this like irrational fear that my mom would die. And, as an adult, we can say, that's not her. She didn't have a terminal illness. She had a bot surgery, which was catastrophic, but that's not the same thing. But that really just shows you through the eyes of a child, like when parental illness or disability, when it happens in ages, the effect that it could have, it's profound because of
Yeah.
that level of not understanding because you're a child. And I really lived that.
Yeah. And so were there other adults that were like present with you and your brother that could support? Did they support? What was that like?
So, I definitely want to always say we're a member of a church, and our Christianity is really important to us and our faith. So, we definitely had folks that came around in the early days who would bring us meals and help with transportation, like taking me to school. But the reality is, youth caregiving, and particularly for like a chronic condition like what my mom had. So, as a result of the botched surgery, she had chronic pain and nerve damage. So this was going to be something that honestly was going to stay with her for the rest of her life. So, so in so many ways, extended family and church family, they showed up in the early days, like right after that surgery, but then their lives have to continue on, right? Like, so, it really did become just me and my brother. And, I always have to just shout out him because if it wasn't for him, I wouldn't be on this podcast talking to you about the research, I've been able to do and advocacy work.
Mm.
It's really because of his sacrifices. But it really was just me and my brother in the home of my mom. And again, you can see just how alone we really were through that whole experience.
Yeah, yeah. And especially like when you are young and you feel like, oh, there should be another adult who's helping me to
Mhm.
support me to do this. I think it's interesting how we're able to look back kind of like 2020 on things that happened to us as kids.
Yeah,
And
yeah.
if we've gone to therapy, if we've had those supports and we can kind of see them in a more constructive light.
Mhm.
Let me see what something happened to my camera. It looks like it disconnected. Let's see. Oops, 1 second, y'all. We're having some tech issues on this side real quick. Let me see
It's
if
Saturday, the tech is excited,
I know.
it's relaxing. Let's taking a
Okay, here
break.
we go. It looks like we're back. Okay. Back on the camera
Yeah.
side. But what I was going to say is that I know that like sometimes we as we can kind of think about these things. We can process them whenever we're adults a little bit better, especially if we've had the opportunity, like you did, to go to therapy whenever you were younger. Could you talk a little bit, though, about how, like, as researchers, when we are deciding,
Mhm.
okay, this is what my topic is going to be about, this is what I want to research and learn more about, this is where I want my impact to be, how
Mhm.
you used your life experiences, your vulnerability to say that I'm going to use my story to influence my research.
Mhm.
Um, but I also know in the same vein that if
Mhm.
sometimes we haven't dealt with some of those things, it can be
Mhm.
kind of hard to use our personal experiences in our research. Could you talk a little bit more about that?
Yeah, yeah, that's so insightful, Janelle, that you would even speak on that. For me, I think about one, I always think about our lived experience as that's authentic truth and to not shy away from that. And for me, I just knew I wanted to enact change. Like, I just knew something had to change. I knew when I read that research when I was a master's student that, like, wait, there's millions of other children doing this? Like, whoa. Like, how come we're not talking about this? How come
Yeah.
I'm not seeing these books in the library? Like, we got to do something about it. And it really was motivated out of, I just knew how much caregiving at a young age, as a young adult, how much that really impacted my brother, his entire sense of self, young adulthood and going off to college. That's meant to be the time where you find yourself, you're having a good time, you figure out and navigate those choices about education, career, relationships. And
Mhm.
that came to a complete stop for him. And in many ways, I don't know if stunted is the right word, but it really just holds you back, because it's delaying that navigation that's so critical. We know from developmental psych, in terms of development that happens at an age. And I
Yeah.
saw that. And so when I went on to do research, it actually became really cathartic, because as I'm
Mm.
talking to adolescents and young adult caregivers around the world, I'm hearing my brother's stories reflected. I'm hearing my story reflected. I'm hearing the fear, that I talked about, the irrational fear about my mom. I'm hearing that same fear and worry and stress reflected in stories around the world. And that's when you're on something, right? Like, okay, as a researcher, like you're seeing the patterns and the themes emerge. And that is it. Honestly, it is empowering, it's motivation. And just hearing that truth knows that, okay, this is something that we need to amplify because there's commonalities and we're all coming from such different backgrounds and such different, even geographical places. But the stories, yeah, the themes, the stories, the patterns, it's all emerging and it's quite similar. So that's what I find fascinating and again really cathartic about research. So I love being nosy and asking questions, and I love just hearing people talk. Yeah. So for me, it's cathartic, but yeah, it's a good thing.
Yes. And I mean, I could definitely, so like when we were at the summit this past April and you did the panel with the youth caregivers, I could definitely
Yeah.
see like just the some of the questions that like you asked that I hadn't even like written down or anything like that. Were just like only you could ask those questions because you
Mhm.
do come from a lived experience,
Mhm.
right? And so I do think that that's what makes your work, your research, your advocacy so different or unique than someone who doesn't come from that same experience space, right?
Mhm.
Because you have a
Mhm.
different level of empathy with that
Mhm.
caregiver that's sitting in front of you.
Yeah, yeah. Empathy and understanding. Like you really, really get it. And then when you talk to young people who are caregivers, they want to talk to folks who get it. Like they want to talk to people who understand it. They don't want to have to rehash trauma and all of that all over again. Like they really want to talk to people who are like, okay,
Right.
yeah, I hear you, I see you, I recognize what you're going through. And I think that's so important. So I'm really privileged to be able to do that through the research that I do as especially as a qualitative researcher. I just think there's so much yes, I think there's so much authenticity when you get to interview someone that I think is so special. And I've been able to do survey research too, and that definitely has its place. It's definitely important. We need to do that so that we know the numbers of how many youth caregivers there are, things like that. But there's just something to me about being able to sit one on one with someone and just ask them and meet them where they are and hear their life experience. I just think it's so eye opening. And that's really where I think the creation of supportive policy and organizations can come from. It's because, okay, yeah, you've heard from the horse's mouth what they say they want, what they need. And I just don't think we always get that captured in survey research. It has its place, but there's just something rich about qualitative work.
Yes, yes. And I wanted us to get to that point of policy. But before we do that, I'm also realizing that maybe some people don't know when I say youth caregivers, when you say youth caregivers, maybe they
What are
don't
we
know what
talking
we're
about?
talking about.
What are we talking about? What does that mean?
So, could you explain to me and kind of define in your way of like who are youth caregivers? What does that term mean? Yeah.
Yes, absolutely. So, I always have to give credit though. I did not come up with the term. It actually was coined back in the late 1980s by Professor Saul Becker. He's my mentor and my PhD supervisor over in England. And he also was a young youth caregiver. So we all just are living out this research and lived experience that we do. And so he coined the term back in the late 1980s, young carer. So that's the phrase that you'll often hear in Canada, Europe, Australia. But we don't really use the word carer in the US. We use the word caregiver. So, we typically use the phrase youth caregiver or caregiving youth, and that's referring to a child under the age of 18 who provides support, assistance, and aid to someone who's in their family or in just their sphere of influence, who's ill, disabled, or addicted to a substance, injured from military service, or perhaps has a mental health problem or any other chronic health condition that requires ongoing aid. I think it's really important when you think about youth caregiving to really make the definition quite tight. So, oftentimes when I'm presenting about youth caregiving, I'll get asked, like, oh, well, my child is a babysitter. Is she a youth caregiver? Or oh, I know someone who's doing care because their parent went off to prison, they're incarcerated. Is that a youth caregiver? And we actually, as researchers, we keep that definition quite tight. But I think it's important to say that all care, all acts of care, taking care of someone, it's important. It's totally valid, but it's not what we mean when we're referring to youth caregivers. So, youth caregiving, there's an element where there's a presence of illness, disability, or addiction in the family. That's what makes youth caregiving a little bit different than, say, babysitting or doing chores around the home. So, that's kind of the nuances there that we say. So, many children, if not all, care about someone. But when you move along that continuum where you're adding in illness and disability, and then the hours of care start to add up, and there's more significant responsibilities that that child undertakes, then we say you're caring for someone. And that's the difference.
Oh, I love that. All children care, but as the intensity rises, that's when you're caring for.
Yes.
What that okay, that is some because so we have at Alter, we have a youth advisory board that we just started, so very young stations. And so we have a mixture. We have folks who are just
Yeah.
advocate, and I say just, but who are advocates who
Yeah.
want to be a part of the cause and just said, this is something I learned in my neurology class or my science class, and I thought it was really interesting and I want to get involved. And I'm
Yes.
like, wow. And then you have the other side of the spectrum who's like my grandmother or my parent or someone who I know personally is
Yeah.
impacted by this disease. And I do help provide care for them.
Mhm.
I do think it is interesting on the side of how we as researchers, eventually how policymakers here in the US will define them too as well.
It's true.
Youth don't often, though, I feel in my experience, uptake that term in the same way. It's usually like, "No, I'm not a caregiver, I'm helping out my mom," or
Right.
my mom's the caregiver and I'm helping her out," or "I just, spend time with my grandmother." But
Yeah.
they forget, "Wait, I have I've given her insulin shot. I've
Mhm.
had to come home early to make sure that I watch her, make her a meal, whether it be grandparent, whatever. I
Yeah.
have had to miss out on certain things, maybe in the evening, because I've got to help give my mom a bath."
Yes.
So,
Yes.
like, those are all, like you're saying, the level of intensity of not just caring about that person, it has changed. But for the youth themselves, I guess, have you found similarly that oftentimes they don't really uptake that same identity that we as researchers
Mhm.
kind of define it as?
Absolutely, Janelle. Yeah, you're so spot on there. Yeah, so we say it's the issue of identification. And I think there's a couple of reasons why that issue emerges. I think one, it's because we're not really talking about children and adolescents being caregivers, right? Like there's not a big discourse in our country yet. You were doing the work and others around you, the small number of us researchers are, but it's still really not something that we're talking about. You don't hear about it in the nightly news or on TV or in movies. Right. So that's first the issue. So it's hard for young people to see themselves reflected when the image of a caregiver, a family caregiver, is typically the baby boomer. So someone who's older taking care of a parent or grandparent, right? So that's the one thing is that like we don't see the images out in the public space about youth caregiving. And I think the other thing you said it so succinctly, I think and this is true for caregivers of all ages, you see yourself reflected in the love and the duty and the honor of taking care of someone. And you think about it more in terms of your role. Like, I'm just a good daughter. I'm just a good husband, wife, whoever, whatever it is, you think you're just that. And we say just that, and that's not true, right? Like you
Right.
are, yeah, you're so important. You're contributing to our broken and failed social care system in this country, right? You're doing the care that you're doing is so valuable. But yes, so that is what we also tend to see is that kind of lack of identification with that term caregiver. But from a research standpoint and also from a policy standpoint, it's really important that we start to see children and adolescents as caregivers because that is when you think of collective advocacy, right? When you think about a group of people, then you can say, okay, this isn't just a one off, right? This wasn't just a story that happened to me and my brother. When you can say, no, there's a collective group of millions, 5.4 million children. Oh, okay. Now we might need to do something about that, right? That's a group that we can
Mhm.
advocate for, we can lobby for, we can study. So from the research side, we love having a label, right? Like we love having a term that we can use. But I also say though, when I talk with children, I don't want to get into semantics. So if they say, I don't identify as a caregiver, I identify as a daughter, right? That's just what I'm doing. I say, okay, but what you're doing, the acts of care, that is significant. So no matter what you want to call it, right? Whatever, if you may not feel comfortable with that label, because for some they think that sounds kind of cold to say, oh, I'm a caregiver, which we may not think that, right? But I understand for others they may feel that way. But I also think it's great to empower folks because I think as the more you talk to young people about why that label can be important and how it can also help for others to see you as part of a collective group of people, then they're kind of like, oh, hey, okay, no, I am a caregiver and I'm proud about it. And that's a phrase I'm going to start using. I saw that reflected. I was really proud, Janelle. This past year, we had the first ever peer support group of youth caregivers in a local high school in Nashville. And that was one of the feedback that we got from running that group in the school with high school students is they were caregivers, but yeah, hadn't heard of that phrase, hadn't heard of that term, didn't see themselves that way. But by the end of the group, they were like, yeah, I'm a caregiver. I'm proud to say it. That's what I'm doing. And I love that.
Yes. So yes, because it's almost like when you don't know that there is a term out
Mhm,
there that can
mhm,
identify a little bit better, that be
mhm.
more succinct, wrap a bow
Yes,
around
yes,
it a little
yes,
bit
yes,
of
yes.
what you're experiencing, then you kind of are just, doing it, right? And you're just like,
Yeah,
no, this
yeah,
is what it is. This is what I'm
yeah.
doing.
You're an island
But I
amongst
think
yourself. Yeah.
yes, yes, island amongst yours. Exactly. That's what I'm getting at because I feel like there's a beauty in
Mhm,
like
mhm,
having a term and a term that people can identify with because then
mhm,
now guess what? I have the language to articulate
mhm.
even
Yes,
better what I'm
yes.
going through.
Mhm,
I think back at like whenever I was in high school going through microaggression. I didn't know microaggressions was what was going on. But once
mhm.
I had that term, that knowledge of this is what it
Yeah.
was,
What it
then it's like,
was,
okay,
yeah.
now I know how I can deal with it.
Yes,
And I
yes, yes.
think all of that is also really powerful within
Mhm,
policy. So I know you've kind of like insinuated to some of these
mhm,
aspects
mhm,
already, but I feel like within policy, we also don't do a good job of saying youth
mhm,
caregivers. We don't use that term like at all, really. I mean, at 18, I guess you're technically an adult, so you can like technically qualify for some of those caregiving resources that are out there. But before then, it's like SOL, like do your best or we're not going to acknowledge you really at all. So could
Right.
you talk more to some
Mhm.
of the things that might be happening currently politically? I'm not really hip on what
Mhm.
could be in the work. There could be some, I don't know. And if not, or the little bit that's going on, what
Mhm.
we can do as
Mhm.
researchers, as community members, like how we can also leverage our stories and our work to help to support
Mhm.
um uh supporting youth caregivers and
Right.
policy.
Oh, you just said something there when you said leverage your stories. That's it. That's the piece. So thank you for acknowledging. Unfortunately, we've got a lot of work to do when it comes to policy on a state and a federal level for youth caregivers. You are right that we do not have any named policy yet in this country for youth caregivers. So those under the age of 18. And you're right. If you're 18, then hey, you fall under family caregiving. We know that some family caregivers, if they're over the age of 18, they can get paid for through their state programs for being a caregiver in the home. But that's not true for under the age of 18. And that makes us different from other countries. So in the UK,
Mhm.
they have what's called the carer's allowance, and that starts at age 16. So that starts to recognize and start give money payments for youth caregivers, so older youth caregivers, for what they're doing in the home. And we're behind. We don't even have that in policy. In the UK and specifically in England and Wales, they have the Children's and Families Act and the Carers Act, where there's named policy legislation that requires those in social services to say, if you identify a youth caregiver or a young carer, as they say, you have to connect them to services. Like that's a mandate and law now.
Mm.
We don't have that. So, unfortunately, I think as well of policy because we don't use the term youth caregiver, so they're hidden, they're under recognized, under researched as well. But then also, I think the nature of what happens of children caregiving in the home, I think also gets further hidden because of the threat of social service involvement. So, there's a lot of confusion that still exists in terms of is youth caregiving, is it abuse? Is it neglect? And those are actually very, very different things. And I say that especially as a youth advocate, that like youth caregiving does not get into that territory of abuse and neglect,
Right.
right? Right. So that also, I think that that fear, that real fear, that if parents and adults in the home speak out and say, "Hey, this child in my home is taking care of me," then that they're afraid. What if the state comes and takes my child away, right? So that also adds to the hiddenness of youth caregiving and why I think we haven't seen it reflected in policy, because I think that fear also means, and it perpetuates the okay, so this is private. This isn't happening. We're not talking about it. We don't see it. Hear no evil, see no evil. That kind of phrase.
Right.
Okay, so this doesn't exist, right? So so anyway, so when I think about policy, I think about all the complicated things we have going on there. There are strides that are beginning to happen. So I want to say a
Mm.
positive thing because I feel like everything I've said has been dark and gloomy. Um, there is the work of our one dedicated youth caregiver organization, the American Association of Caregiving Youth in Boca Raton,
Yeah.
Florida. Yes, they are doing the work, especially in Florida, and they have some connections in Delaware where they're trying to get youth caregivers as part of named legislation to protect
Mm.
family caregivers. That's still in the works. So, we need that momentum. The talks like what you're doing are so important to, again, give more weight and more credence to why this is important. I know there's a lot of work as well with the AACY in terms of including children as part of the National Family Caregivers Month in November. That recognition that children are a part of that. Yeah. So we're not there yet, but those are the kind of the pushes that we're trying to do. But it takes us all.
It does. And one of the things that popped into my head as you were
Mhm,
speaking,
mhm,
you talked about at 16,
mhm,
um,
mhm,
in the UK that they have set up to where you can start getting paid as a youth caregiver. If that could ever happen here in the US, the thought that really came to me is when I was about 16, I told my mom, I said, "Mom, I want to get a job. Like, I want, my own money and blah blah blah. She's like, you're not gonna like working. Don't do it. So I was like,
Like
no, I
non-self-care.
want to. Yeah. I was like, no, I want to. And so I did because I was like, I'm 16, I can do it. I have a car now, I can drive, blah, blah, whatever. I wanted to be grown. But I think about how a lot of low income POC youth,
Mhm,
how they
mhm,
might be actually starting to work at like 14,
mm.
13,
Yes.
whether it be legal or illegal,
Mhm.
because money still needs to come through for the family,
Absolutely,
right?
absolutely.
And so I guess I also think about with that,
Mhm.
within youth caregiving, I know we're just trying to get kind of to the stage just in general, but those cultural, the race differences and impacts, as well as SES impacts, maybe yes, cultural impacts that you also might be seeing within your work. How can you speak to a little bit more, especially with
Yeah.
Black youth, since this
Yeah.
platform is really about the Black community, how they're specifically being impacted, maybe a little
Mhm.
bit more or uniquely differently
Yes.
than their other peers.
Yeah, yeah, I'm so glad you recognize that because that is so true. We're seeing that in research. So, we know in our country, Black, Brown, Indigenous, Latinx youth caregivers, unfortunately, are disproportionately impacted by what we consider to be the negative outcomes of youth caregiving. So, we see higher rates of anxiety, depression, self-harming ideations. We also see, when you spoke of about socioeconomics, we also see that those groups of youth caregivers tend to be more in working poor families, so the working class, and those in absolute poverty, right? So we see the economic disparity. What was really interesting in the COVID-19 pandemic, the Institute for Women's Policy Research, they also found that Black girls and young women were doing more work in the home, so more family caregiving, than their white counterparts during the COVID-19 pandemic. So we know that that's something that all of it is affecting us more, our community. And then when you couple that in with like the work of Dr. Feylyn Epps, so we know things like Alzheimer's and dementia also disproportionately affect our communities. It all makes sense. Like all the pieces start to come together, right? And then you add in all the isms, so racism, sexism, classism, ageism, I'll just list them all. But all of that, it all becomes this like imperfect maelstrom that's working against Black and Brown girls in our community. And I say girls because we know that there's within care, we know that girls and young women tend to do a little bit more care and within the home. But I also want to make sure I shout out those who identify as male because they also can be hidden, like my brother. Like we think of the image of a caregiver being a girl or a woman, but boys are doing
Mm.
care too. So that's important that we call that out and we see that. Yeah. So that's a myth that the caregiver in our country is a girl. But we also know though that care is a cultural expectation within a lot of Black and Brown families. So, you hear that phrase, you don't put grandma in a home, right? Like you in a nursing home, like you keep her, you age in place. And that expectation, and maybe a bit, may even say pressure in our communities to do that, I think also adds in to the youth caregiving experience, knowing that our families, our homes tend to be multi-generational, knowing that we also include as family, the cousin who's not really a cousin, but they're cousins, like we add in all of that. And care is an important part of our community. It's who we are. I actually think that's a valuable grit moral thing. Like I really do not think that's a bad thing. I think unfortunately though, when you have those isms and then those negative outcomes that you see because we're already on the margins of society and under supported and financially precarious, then that's where the elements that's when we see those negative impacts
Mm.
affect us more. It's because of that, but not because
Mm.
caregiving in itself is bad, right? That's not true.
Right. Right. But I do think it is important, like what you just brought up in terms of boys, because I think we also see it very similar with men, right?
Hmm.
With male caregivers. And how oftentimes they don't feel this is not like a role that was like built for them, right? That's kind of like not the thing that they feel like. Caring is not what I was taught when I was younger. I didn't have no baby dolls. I didn't do
Right,
this.
right,
And
right,
now I'm kind of
yeah.
thrusted into this space, right? And I
Mhm,
do feel like a lot of boys also
mhm,
kind of feel that same way, like almost just societally, if you take on gender norms, right?
mm,
Um,
mhm,
they're just not conditioned in that way, especially if that's not how your family was. You're just not conditioned in that way. And I
mhm,
do remember one story that I heard of a young boy who started to kind of resent his mom in a
yeah,
way because
yeah.
she had dementia and he just didn't really understand
Mhm,
um what was going on. The conversations weren't really had with him about this is kind of like the disease progression, but the
mhm,
expectation was just jump in and help. Just do it. That's what you're supposed to do. Come on.
right.
And his dad was very like, I don't understand. I don't get why you wouldn't do this for your mom. And it's like, it's not that I don't want to do this for my mom. This is just so different. And I'm
Yeah.
also grieving as
Yes.
well, right? Like
Yes. Yes.
what I once had with my mom is just not that anymore
Mhm,
necessarily.
mhm, mhm,
So
mhm,
I also do think, and I know the mental health side that you have, the background that you have.
mhm,
How can, because I'm in clinical psychology, getting my PhD in that. And so how can mental health professionals
mhm,
really better support our youth caregivers? What did you wish that you got that you didn't
mhm,
get? I know that you
mhm,
wanted your therapist to identify more with your story, but how
mhm.
can we just support them in the best way?
Yeah, thank you, Janelle, for speaking to that. So, if I could, I'll share a little bit about my story and how I had someone who saw me and intervened for my mental health. So, when I was in college, I was in my junior year, and the recession had hit, and we lost our family home. And my mother's mother, so my grandmother, she passed away. And then my mother's sister passed away 3 weeks after her. And then my mother was having a flare up of her chronic pain. So she was in the hospital. So I would be studying at Vanderbilt in the school, like going to class, and then going to her bedside at the hospital and sleeping and studying next to her in the hospital room. And I was not okay. I was stressed, exhausted, scared, worried. There was so much going on, you know. And I had one professor, she was a Black professor, and she pulled me aside after class and was like, Feylyn, you are not yourself. What's going on? And it was like word vomit of me, like, this happened, and we lost her home, and then my grandmother died, my aunt died, and this, and my mom's in the hospital, and like, blah, 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 blah. And she's just like, okay, you need to go to the University Counseling Center. And I'm like, okay, thank you. And I am so glad that she did, because that's how I actually got connected with a therapist. That's how, even though my therapist hadn't heard of and didn't even know there was a term called youth caregiving, but knew that I needed help, knew that I needed a professional that I could talk to about all of the weight, all of the stress and strain that was going on within my family. And I'm grateful that I had friends, but my friends didn't understand. I remember telling a friend about it, and her eyes just widened as in like, oh, this is a lot, but this is a lot, right? So having that trained mental health professional was really what I needed. And, that Black professor, I am forever grateful for her that she saw me and she just asked one question. My guess is she probably doesn't know anything about youth caregivers, right? But she still could help. And I think that's what's so important for mental health professionals, is to hear that message. And I think that's true for school administrators, professors, teachers, whoever who's listening, to know that, hey, you can help and you can intervene with a youth caregiver. Just stop and ask a question. How are you doing? Listen with empathy, listen for what that child or that young person is going through, and then connect them with mental health services. So, I know that mental health services can be, a disparity in our country. There's a lack of access, but there's so many online resources. The American Association of Caregiving Youth has so many resources online. So, there's help out there. But the more important thing that I say is recognize a child and ask how they're doing, because that made all the difference in my life.
Mm. So it's not even about, oh, I need to know all of this stuff about the population and what they're going through and all of that stuff. It's really just, can you be someone who can, one, empathetically listen and hear and just be available
Mhm, mhm,
to allow that child to tell you what's going on? But then I think the next step of like what you kind of said at the end is then learn. Then learn
mhm,
about those resources
mhm.
that are out there. Even though it's a little bit, learn about what those are so that you can connect them to something, right?
Right,
I
right.
think also too, whenever you talk, I kind of go back and I think about your brother and you also navigating the healthcare system,
Mm,
which from my personal experience, got
mhm,
a master's in public health, did all of, whatever the things you could say. If I took a survey, they'd say that health literacy is like fairly high, whatever, whatever.
mhm,
But when we were navigating the healthcare system with my mom,
mhm.
that was a different beast.
Yeah,
It's like we didn't know anything. And we didn't know anything,
yes,
right?
and
And
sidebar.
so yes, and that's what I'm saying. I can only imagine
Mhm,
being younger, being
mhm,
a youth, not having necessarily
mhm,
your mom was a nurse, yes, so she could probably help
mhm,
some in that sense. But like really being in there and buckled in with all of the doctor's appointments and everything that had to also be done, just tell us a little bit more. It could just be really about the experience of navigating the healthcare system, being so young,
mhm,
but really how doctors, social workers, people in those medical spaces, what
mhm.
they also need to do and learn.
Yeah. So you nailed it. Definitely that education piece is so crucial because now that I'm an adult and I'm a trained professional myself, I look back and I realize no one spoke to us as the young people in the room. Like, like we were the experts in what was going on with our mother. But yet we were hidden in that room. We might have organized the appointment, may have gotten her there, right? May have been the person staying up late taking care of her, but we weren't addressed in that room. And that's something that we've really worked with my European colleagues. We've really worked to train healthcare workers in that, as recognize the child and teenager in that hospital room, in that doctor's appointment room, as the expert in that family member's care. Speak to them, include them in the plans, right? And that's not to put further pressure on the child, but it's to acknowledge and recognize them that, hey, they can lend a piece of critical information into the healthcare plan for that ill or disabled person, because they're already doing it. They're already doing it in the home. So recognize that. That
Right.
helps the other person be seen and validated and also understand. Because again, I spoke about earlier with you about that irrational fear that I had. That's because nobody explained. Nobody took time to explain what was going on with my mom. And that would have made all the difference for me. And in terms of minimizing the trauma of such a catastrophic
Mm,
experience, if someone had spoke to me in child-friendly, accessible language about what was going on with my mom, and I hear that when I interview children and young people, as they say, like, I worry that whatever's the disease condition of my parent or grandparent, that it's hereditary. Like, am I going to get that? Like, is that going to happen to me? But like, nobody's talking, nobody's explaining. And so I think that's what we really need, is recognize that child and young person in the room and speak on their level and educate them about the health condition, because that, I think, will do tremendous amount in reducing the fear and worry that's on that young person's mind too.
absolutely. I am like super proponent
Yeah.
education, education,
Mhm,
education, because I just feel like when you are a more aware person
mhm,
of like what's going on with you or your family member, you now
mhm.
have the power. You're now empowered to be
Yes,
able to
yes,
take action.
yes, 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 absolutely, absolutely.
So, yes, I completely agree and am in alignment with that. I know that we are unfortunately, oh my gosh, because I'm like so enjoying this conversation. We're kind of heading into to the end of our session today, or our talk today. I'm right now, I'm in, what do you call it? Therapy, my
Yeah,
client
we're
mode.
just I love it, I love
Session.
it.
But yeah, but now kind of ending. I want to know kind of before we leave, like with something to leave kind of our listeners to, with all of your experience navigating not only your own caregiving journey, now you said currently as a caregiver, um and being an academic,
Mhm.
what words of wisdom you can leave people
Mhm.
as they continue to use their stories within their research and their work, and as they currently go through life doing the work, right? Because I think we often forget that we are also a part of the community,
Yeah, yeah.
and we also need to take care of ourselves, and as we're trying to like care for others too as well. But just some words of wisdom and things that you've learned along the way,
Yeah.
that can really just help to inspire and support researchers and our listeners.
Yeah. Well, thank you, Janelle, for this platform. I think the first thing that comes to mind is don't shy away from your lived experience and connecting that to your profession and to research. That really makes you the expert on that, right? Because you said it already. You can speak with authenticity and truth. And that's powerful. Like, that's different than somebody saying, oh, this looks like an interesting research topic. I'm going to do this. And they have no ties or connections or understanding at all, right? Because then it's like theoretical. But when you have lived something, it's innate. It helps you connect more closely with your research participant. It enables you to ask the right questions, get to the heart of the matter, and tease out themes and research. So that's definitely an encouragement to any of you in academia right now, is don't shy away from your lived experience. Use it and amplify it, and analyze it, have that lens to it, and reflect. So I think that is a positive thing. The other thing that I would say to any caregivers who are listening is, as you said, that self-care is so true, so true. I think it's so cliched. We say you can't pour from an empty cup, but it is also true. So I recognize, as a continuing caregiver, as a millennial, as I identify as working caregiver, it is hard and it is exhausting, and navigating all the care coordination of doctor's appointments and scheduling. Whew, it is a lot. In that, you cannot forget to take care of yourself. And that is not selfish. That is not, in fact, I always say I'm a better caregiver when I'm not hungry, when I am rested, right? Like I'm nicer when I am taking
Yeah.
care of myself, right? So make sure that you are filling yourself up. For me, it's like I like to play tennis and I'm bad at it, but that gets my body moving, gets me doing something a bit different than, me doing my research that's very analytical and very heady, right? Very intellectual. That gets you doing something. So find that, whether it's that 5 minutes of peace in your shower in the mornings where no one is bothering you, the
Yeah.
phone's not ringing you, you're not doing your emails. Find your pockets of peace in the day and hold on to that. I think that's
Mm.
what we have to find as caregivers, so it's sustainable, because many of us on journeys where we're caregiving for years, for decades, and we have to find practices that allow us to stay in the work and not suffer our own health detriments, right? And I've experienced that too, so I get that. Right? So that's what I would say. It's cliched, but truly find your peace, find what restores you, and hold on to that and make that a part of your practice.
Yes, yes, those little pockets
Yes.
are really important to be able to identify.
Mhm.
Well, thank you so much, Dr. Lewis, for being on the Black Scholars Speak podcast platform. We're excited and happy to have you a part of this community. And so before we hop off, if you could just kind of tell everybody what your email, how they social media handles, how best they can kind of contact you if they want to connect.
Yes, absolutely. So thank you again, Janelle, for having me. And I'm so excited to be partnered in this work with you. You're doing big things and I love it. But yeah, I would love to be connected with anyone. If this resonates with you, whether you are a researcher or a caregiver yourself, please reach out. My website is www.drfeylynlewis.com. I'm also on all social media channels. I use LinkedIn the most, and that's a good way to keep up with my work and the advocacy that I do. So find me on LinkedIn. I'm on Instagram, I'm on Facebook, I'm on Twitter, all the things. So please reach out. I would love to hear from you, and I love hearing your stories too. That always fills me up. If something I said or Janelle said today resonated with you, tell us. Like that means so much, and gives more truth to what we're doing. It helps us know we're in the right place, doing the right thing.
Yes, absolutely. Couldn't have said it better myself. And I will put all of those too in the description of this podcast episode. So you can definitely reach out to her. Y'all know how the format goes. So if you are interested in listening to her breakdown episode, then be sure to click the next episode to listen to as well. But thank you so much, Dr. Lewis,
Thank
for being
you.
here, and for everybody else. If you are interested, or if you are a caregiver and you want to learn more support resources, or you want to continue this conversation, then definitely reach out on our Instagram account, Black Scholars Speak, with only one S. And we can definitely see how we can kind of continue this conversation on this platform too as well. Alrighty, well, that's all we've got, guys. Talk to y'all soon. Bye.